After the well-known hashtag FOMO, this is FOMI, fear of missing information, and the kind of impulse and sometimes compulsion to check information. And I have nothing to disclose, and this is evidence-based, mainly grounded in cognitive behavioral therapy principles. But we'll talk about how this tendency or orientation towards gathering information can both soothe our anxiety and also heighten it, and strategies for helping us to manage that. So I'm going to flip ahead to, these are some fairly obvious slides to make the point that everyone is really experiencing this, not just people in healthcare. The uptake in terms of news, this is from a media data site. News usage has gone up. Their social media use has gone up in terms of frequency during the day and amount of time spent on social media, which can have some positive benefits, like connecting us socially. A lot of it is this quest for information. And people are talking about this as its own form of epidemic, infodemic, it was called by the Wall Street Journal. And really noticing, if you look on Google, this is data from Canada, even the searches of things like panic. So there might be a feedback loop here where we're uncertain, we go looking for information, and then we have symptoms, and then we Google to try to find out how to manage those symptoms. So real uptick in searches around panic. Sanjeev showed this graph last week, and certainly distress and anxiety are very common reactions, both during a pandemic and afterwards for healthcare providers. And there are different factors that can inflame that panic response. Exposure is one of them. So where we work, how close we are to things, whether we experience loss or death. In SARS, whether you have young children. So there are lots of different exposure factors, and we're going to talk about many of them in the coming weeks. But one of them might be exposure to certain kinds of news, especially sensationalist news, images. I heard so many people talking about the images from Italy and people being very impacted by those. This is an article that frames this idea and looks at other disasters and what exposure to news and a lot of media exposure can do to people. And it can have not only immediate impacts in terms of distress, but also longer term impacts. And the phrase that they use is amplification. So again, that feedback cycle, it's a positive feedback loop of negative things, like so our behavior intensifies, our anxiety can intensify, and our searching in the news can intensify. A lot of what underlies that is the uncertainty. And I'm just going to flip to this image, because I think this shows that idea that our brains, especially our amygdala, which is very heightened, and in uncertainty, we're looking for ways to appraise threat, to figure out how real it is for us. Are we in the age group? Are we in the areas that are dangerous? So and the more information that comes in, we see whether we can cope with it. And if we can cope, we feel less anxious. If we feel flooded with information or feel that we can't cope with the kinds of risks that are being identified, all of a sudden our anxiety can go up. There we go. And there are individual differences as well. Some people are more monitors and very vigilant and really looking for information. Others are more on the blunting avoidance side. But people who tend towards higher degrees of anxiety actually tend to oscillate between these two strategies. They become very hypervigilant and monitor, and then they can't deal with it or become overwhelmed, and then they blunt and avoid. And each strategy, what's important is identifying what our strategy is, what our set point is, and figuring out what are the benefits of that and what are some of the downsides. Some of the downsides of being a monitor or being hypervigilant is the tension, the anxiety, the preoccupation, the way it distracts us from other things, insomnia, intrusive worries, some of the challenges with the blunting and avoidance are maybe we don't take it seriously enough, and maybe we actually don't follow some of the safety things that we should be following. Okay, and this is what I'm going to introduce to talk about a brief anonymous case, but I think it resonates with many of the things we've all shared. The ABCs, any of you who are familiar with cognitive behavioral therapy will recognize the dreaded triangle, but the way that our feelings and our thoughts and our behaviors are all linked. So in the example of somebody reading the news, this happened to me. So in the weeks leading up to this, before we knew how bad it was going to be, I heard a little bit about it and I immediately thought, you know what? I'm not usually prepared for stuff. I better get prepared. I got to get groceries. And so that was my thought. And it was associated with a very mild anxiety, enough to get me off my couch and going to get groceries. But the problem was I went a little overboard and I got a lot of groceries. Now that doesn't have a lot of consequences. What one has to ask, so you look at how your thoughts, feelings, and behaviors are connected, and then you ask, is what you're doing helping those feelings or hindering them? And sometimes in the example of checking news as a behavior, sometimes it's helpful, sometimes it's not helpful. All right, well, let's do the little vignette and then we can go back to this triangle and think about how it might apply. And obviously it can be used for self-reflection, and then with colleagues or clients, you can use this kind of model, pull out a triangle. And it's always a hypothesis, what we might be thinking. And we're really just kind of testing it out to check in with our feelings and think about our behaviors. So this is a woman who's an emergency room physician who was due to return from a mat leave that she had taken over the last year. And she was already a little bit worried about returning and spending a good chunk of her day, 3 hours, studying, trying to get her skills up, thinking about being back at work. And then all of a sudden, COVID hit, and now she's realizing that when she actually does go back, it's going to be right into the midst of this pandemic. And so now she has stepped it up. She's spending 6 to 8 hours researching, feeling that she has to understand everything that's known about the virus. She's having difficulty falling asleep, feeling a sense of dread, and not really wanting to go into work. So does she have a history, a biological history of anxiety? She's also postpartum. She's not sleeping now. So thinking about the biological side of things, the psychological, and this is a good framework to try to help somebody to think through, and pay attuned to what are their thoughts? How are they processing this? We might wonder, maybe she's going to say something like, I'm so attached to my daughter, I don't want anything to happen to me. Maybe that's her worry. Or I don't want to bring something home. Or maybe it's like, I don't want to let down my colleagues. So trying to understand some of her thinking and that psychological piece, absolutely. What are her emotions? As you mentioned, what kind of coping strategies does she currently use? Is she more of that hypervigilant? Is she an avoider? How does she use other people? You mentioned socially. So having that full holistic perspective for sure. And what does she think about how she's trying to cope with this? I think what I'll do, I don't see any hands or any more comments in the chat. I'll just go to my last slide because I'm also getting messages from Sanjeev. Telepathy. These are some very basic tips that we can derive from understanding cognitive ways of coping. So understanding our own approach to information, what are the emotions that we have when we're searching, what does searching news and taking in news do to our emotions, how are we thinking about it, what kinds of behaviors do we have, appraising the information we consume, and Mona talked about that, going to trusted websites, not cruising and clickbait. And limiting our consumption, especially around bedtime, giving yourself that buffer and spending time with people, not just online, and cultivating other coping strategies. And we have lots of stuff that we're going to post online. I'll leave it there, Sanjeev.